Dr. Oz, what can the average American do? If I'm watching this and I'm furious, I'm already furious about what's gone on in Minneapolis. I'm now learning that California is the next epicenter to explode with regard to fraud. And it's obviously not just going to be healthcare. I mean, we all know that there's 22 billion lost here on a homeless crisis, that Newsom just vetoed a bill which would allow extensive auditing into where that money went. You got 15 billion on a high-speed rail without one serviceable track. You've got billions into this care program that's apparently only helped 22 addicts. I mean, it's insane. What can just a regular person do to be helpful here?
Well, you got to actually tell the truth to the people around you. I have a good friend of mine. He's an older gentleman. He came from Eastern Europe. And he said the biggest problem that he had growing up was that he knew everyone that was talking to him was lying to him. But that wasn't the biggest problem. There was an even bigger issue that he knew that they knew that he knew that they were lying. That's what I fear is happening right now. Everyone's lying and they know they're lying and no one's holding folks accountable. No. So it's hard to tell the truth. It takes a lot of effort. People are uncomfortable. You say things you wish you didn't have to say because you might be, upsetting people. I'm a doctor. My job is not to make sure you're not upset. It's to make sure you've learned something that can help you survive, right? Help take care of the person in front of you. And that's what I'm asking folks in California to do. Talk amongst yourselves, be clear on the facts of what's going on. But a couple of very concrete things. Do not sign documents if you're on Medicare if you don't really understand what they say. We will not send you a document to send back to us, but that's not really crisply delineated, and it's very rare if we do that. So make sure you're not being tricked. Take care of your loved ones. I'm asking young people across California, contact your senior relatives. Make sure they're not getting tricked or duped or being put in home health care they don't need to be in, or God forbid, sent to hospice when they're not that sick, right? And these are the kinds of these are incredibly powerful steps because we have to change the culture.
Yeah.
Right now in Southern California, it's expected that you can pay someone to refer their patient to you. That's all got to stop. And I've submitted several dozen names of doctors in Southern California to the U.S. attorney to go after because we believe that they're involved in fraudulent activity. Why? Because I see their names on multiple hospice patients claiming they're all going to live for less than 6 months. And when I read the documents, the medical records, they got a little blood pressure problem. You're not going to die in 6 months.
Oh my gosh.
I mean, my goodness, they have better actuarial survival than me and you.
This must make you so furious. Question for you. For anybody watching who would suggest, this is partisan. You're just going after Newsom because he's going to be president. You just talked about Florida. How's DeSantis handling the accusations of fraud in the Cuban community? Is he calling you a racist? Is he saying you're a liar? Are they cooperating with you over there?
Governor DeSantis is taking it like an adult. He knows there's a problem. He's been trying to get his arms around it. It's hard because the Cubans are very clever. And the Cuban government with using folks, we believe. And I was told that, by the way, by Mayor Suarez, who was the mayor of Miami. So these are not like baseless allegations. I think they're from people that are credible. And Mayor Suarez is Cuban. So he's saying, I'm worried about the Cuban government using Cubans who come here to do construction work, tricking the system and sending them millions of dollars. So that's what we need. And we need the same kind of responsible action in Minnesota. There are other states we're going to, and we are I'm very passionate about taking care of our most vulnerable. I don't want to lose the money, but it's the people I care about. And that's who's being harmed with this fraud. So red state, blue state, doesn't matter. I'm coming to a neighborhood near you. We're going to clean this mess up.
Oh gosh, Doc, I love that so much. And I think people don't understand. You're an exceptionally successful individual. There's no money in this. You're taking on personal attacks when you're beloved as America's doctor. This is a true act of altruism. There's nothing in this for you except sleepless nights and personal ad hominem attacks. Final question. If you aren't able to get your hands around this, what does this look like in 5 years? Will there be less providers? Will costs be driven up? What are the long-term consequences of this kind of fraud?
If we don't deal with this fraud, we are going to become a massive healthcare system with a small country attached.
Wow.
The increased amount of money we are spending on healthcare is dwarfing that of the GDP of inflation. We're growing at twice the rate of the country's growth. And so we have to deal with it at many levels. And by the way, I have so many good people around me. The best part about this job, and it is the best job I've ever had, and we've worked together for years, it's just come in the government because you got great people who want to actually make a difference. They're all mission aligned. But there are things we can do using AI, changing the way we improve the workflow.
Yeah.
When you go to see a doctor, giving you better advice, meeting where you are so patients get better insights about their own healthcare. All those things are happening. But if we bankrupt the system by stealing all of the money out of it, we're never going to be able to reinvest it wisely. But the bigger issue is when you put people who don't need to be on these programs, you dilute access to service. You no longer can get the care you need. I'll give you a concrete example. That's not based in California yet, but it might be. In Minnesota, they thought they would be spending $3 million on children with autism.
Yes.
And they were going to invest this $3 million to give the kids who are there, and not every child has autism, but what enough do that there was going to be a need to pay families to help these kids get through their days and manage their issues. Fine. The budget now is $400 million. So forget about the fact that it's more than 130 times more money. Who's going to take care of the kids if all the kids are diagnosed with autism? Yeah. Why does every child have autism? Because they started paying moms to lie that their children had autism because they could get paid money. And the kids who don't need services now are forced to take care of services because we're paying the service providers to take care of kids who don't have a problem. So you understand that it's a perverse process where if you don't do it, they think you're dumb. I'm paying the moms, I'm paying the providers, the kids, God bless them, have no idea this is happening. And you're just ripping money out of the system, but also diluting care for the kids who need it. This is what political patronage and dishonesty in these precious programs does. And again, the money is not the primary problem. It's hurting the people who are most vulnerable. Hubert Humphrey, whose name is on this building that I'm in right now in Washington, he said something beautiful. And he's a Democrat, by the way. He said, it is the moral obligation of government to take care of those at the dawn of their life, which are our children. We cover 53% of kids in America. Most children are covered by Medicaid, by our insurance or CHIP. We have to take care of those at the twilight of life. Those are our seniors. Every great society takes care of its seniors. We're great people. We're going to do that. You've worked your whole life. You've contributed. We respect you for that. We would help you. So those are the dawn of life. Those are the twilight of life. And those living in the shadows, the kids and the adults, and also people in the shadows. We've got to take care of these people. Our fellow man needs our help. Cowardly acts, running from the challenges of dealing with corruption, of powerful forces who can influence what's going on in your life, who are uncomfortable to fight against. Nobody wants to fight the Russian mob in LA, but someone's got to do it. I mean, my goodness, they elected you. Go do your job.
All right, guys, if you like this clip and you want to watch the full episode, click here. And if you want more content like this, you can subscribe to the show by clicking here.